Hello, good afternoon, everybody. My name is Tamsin Rose, and I'm the Senior Fellow for Health and I'm also the coordinator of the newly launched Africa-Europe Strategy Group, part of the Europe-Africa Foundation that was launched a few days ago in collaboration with Friends of Europe, the Mo Ibrahim Foundation, the One Foundation, and the African Climate Foundation. And this is looking to create a new partnership and dialogue between our two continents. Today, we're very excited to have the launch of the EU for Health Security in Africa, the partnership between the African CDC and the European CDC. An element which will build on health security in both continents. A perfect example of how mutual opportunity and mutual challenge will bring our new continents towards working together in a different way. So without further ado, I would like now to pass the floor to the first person on behalf of the two partner organizations. And that will be, I'm going to give the floor to Ambassador Birgit Markussen, who will give us a short introduction to today's event and the specific partnership. Birgit, the floor is yours.
Thank you very much. Thank you for this opportunity. So let me, dear is Commissioner El Fadil, Director General Koen Doens, who is also one of my bosses, heads of the Africa CDC and the European CDC, colleagues, ladies and gentlemen. It is with a very, very great and special pleasure that I'm welcoming you to the launching of this important joint initiative between our two specialized agencies, the European CDC and the African CDC. It is rewarding to see the discussions that started back in 2018 are bearing fruit with this joint action. As you know, this launching is happening in the midst of the fight against the COVID-19 pandemic, in which the two CDCs are playing their respective crucial roles in coordinating countries' emergency preparedness and response efforts. One of the things that this pandemic revealed is the crucial role of each agencies, and of course it reaffirms the conviction of the European Union and the African Union to strengthen these agencies and their multilateral action. We're delighted with this new action, and we expect that both continental CDCs will be able to work together to fight the current pandemic and hopefully also the future ones. This is also happening at the right moment when the two unions
it is on the socio-economic impact of COVID-19. It is a document that's been initiated by the Social Affairs Department. Then we opened it for the inputs of the 8 departments of the African Union. Then we shared it with 11 of our partners here in Addis Ababa. Also, they gave their inputs, and we are taking this document to our STC in the first quarter or the second quarter of 2021. But for us, it's a very important document because it addresses in a holistic way the socioeconomic impact of COVID-19 in Africa. Excellencies, the European Union Center for Disease Prevention and Control, CDC, and the Africa Center for Disease Control and Prevention, Africa CDC, are launching a new partnership to strengthen the capacity of Africa CDC to prepare for and respond to public health threats in Africa. And as I would like to join also Ambassador Birgit to say that this is part of our strategic partnership. The strategic partnership we have between the European Union Commission, the African Union Commission, in 1 or 2 days, replacing the expected summit. Unfortunately, because of this COVID-19, we are not able to have our usual summit between the African Union and the European Union, but the partnership is a strategic partnership, and this area is an area that we are expanding on. It's in the collaboration in the area of health issues. And this also, it was initiated, Ambassador, if you remember, first initiated into the college-to-college meeting, the one we had in process in 2018. Then again, health issues, even before this COVID-19, were the priority in our negotiations in the college-to-college meeting here physically in Addis Ababa before COVID-19. So what I see now, what we are doing, is we are going very fast on taking this partnership to a very practical area, launching today this initiative, and also the task force and the other initiatives in health. And I do appreciate very much this, the European Union taking this partnership very seriously with us in the African Union Commission. Excellencies, the European Union Commission is funding a 4-year project, EU for Health Security in Africa, between the two CDs, which will also facilitate harmonized surveillance and disease intelligence and support implementation of the public health workforce strategy of Africa CDC. And again, I would like to appreciate this financial support very much, and to commend you for coming quickly to our help, because this financial support is a timely, really a timely support for the Africa CDC. Excellencies, the goal of the project is to strengthen Africa CDC capacities in preparedness and response to health threats, facilitate harmonized surveillance and disease intelligence of outbreak-prone communicable diseases at continental level, and also to support the implementation of Africa CDC's public health workforce development strategy. The project is also an opportunity to be able to respond to the needs of member states in a more timely and efficient manner through the strengthening of their needs. This will also be achieved by strengthening the capacities of the regional RCCs of Africa CDC. And as you know that we have 5 regional collaborating centers in 5 countries. We have in Zambia for the Western region. We have Egypt. We have for another region. We have Kenya for East Africa region, and also we have Gabon for Central Africa. And this project will be extended to support our RCCs. Excellencies, through this partnership also between the 2 specialized agencies of the European Union and the African Union, Africa CDC and Europe CDC, we will be able to exchange experiences and lessons learned from working with member states on the continental harmonized surveillance of infectious diseases, on data sharing and early detection of threats, as well as on preparedness and on risk assessment. Also, we can extend to the area of rapid response and emergency operations, and also on how to adapt these to their needs. Dear participants, we appreciate all the support from the European Union, especially this project between the 2 CDCs, which is timely, as I said, and being a long-term partnership, we will go a long way also in supporting capacity building of our public health institutions, and also our health workers in Africa. Systems support of the European Union Commission that we will manage to build the capacity of our member states. Excellencies, I would like to conclude by saying that we anticipate that this partnership will be the start of a more strengthened collaboration between Europe and Africa. And I would like also to take this opportunity to express our sincere gratitude for the continuous commitment of the European Union to advance Africa CDC capacities in preparedness and response to health threats and other public health interventions. I thank you very much again on behalf of the African Union Commission, and I look forward to the launching, and also to working very closely together, the Africa CDC and the Europe CDC. And we would like also to extend this partnership in the area of vaccine. Bridget, we spoke about it, but it's also it's a priority for us now. I believe Dr. John can shed some light vaccine acquisition for Africa. Thank you again.
Excellent.
Thank you very much, and back to you.
Thank you very much, Commissioner, for giving some of the context in the background and highlighting how strategically important this is for the future of the continent and video.
Dear colleagues and dear friends, it is a great pleasure to join you today to mark the launch of this much promising and much needed partnership between the European Centre for Disease Prevention and Control and its Africa counterpart, CDC. Back in February, when together with my European Commission colleagues, we traveled to Addis Ababa for the African Union EU college-to-college meeting, the world could not yet fully grasp the extent of the unprecedented challenge we were faced with at the time. The coronavirus pandemic has since dramatically affected our way of life in every corner of the world, causing severe human suffering, with close to 1.5 million deaths and more than 63 million confirmed cases. Its socioeconomic consequences can still not be addressed to their full extent. The pandemic has also revealed more clearly than ever what we already knew from the Ebola, SARS, Zika, and cholera outbreaks of the past decade. Namely, that the health security, a long-standing objective in the cooperation between the African Union and the European Union, must indeed remain a global priority. It is essential to defend health as a global public good. In Europe, over the past months, we have taken unprecedented historic steps towards a European health union. In November, we adopted a new robust health security framework, which will allow us to deal with health crises more effectively. This includes a legislative proposal to strengthen the mandate of the European Centre for Diseases Prevention and Control. Our agency, the ECDC, plays an important role in crisis preparedness and response to infectious disease threats and outbreaks. With our proposal to extend and provide a new mandate, would allow the ECDC to issue stronger recommendations on measures to control outbreaks, to step up data collection, analysis, and modeling, to reinforce the prevention capacities for communicable diseases and issues such as antimicrobial resistance, vaccination, and biosecurity, and to build up the key competencies for health protection in EU member states through a new network of EU public health reference laboratories. Last but not least, we want the ECDC to have enhanced capacities in field response by mobilizing and deploying an EU health task force to assist local response in member states and third countries. With this proposal, we seek to reinforce the ECDC's contribution to the EU's overall international cooperation in the area of health security, preparedness, and response. Through our external action, we pursue a rights-based and universal approach to health in accordance with the values that public health systems within the EU are built on. In Europe, Africa, and the rest of the world, our investments in health are investments in prosperity, social and financial protection, security, and importantly, well-being. The pandemic has increased the urgency of working together. From early on, the European Union and its member states acted together as Team Europe to support partner countries on three fronts. First, on the immediate, urgent response to the health crisis. Secondly, on strengthening healthcare systems capacity, research, and innovation to fight the virus. And thirdly, mitigating the socioeconomic effects of the pandemic. To this end, we have mobilized 38.5 billion euros, both as EU institutions and EU member states. We have spearheaded a global response, catalyzing partnerships such as the access to COVID-19 access. And we are proud to have contributed significantly to the COVAX facility, providing 100 million euros in grant support and 400 million euros in guaranteed loans through the European Investment Bank. Dear friends, Africa has also been resolutely tackling the pandemic. The African Union has been leading the continental response to COVID with key strategies and platforms rapidly established. The Africa Joint Continental Strategy for COVID-19, the Partnership to Accelerate COVID-19 Testing, the Africa Medical Supplies Platform, and the Consortium of COVID-19 Vaccine Clinical Trials. They all demonstrated the leadership of the African Union and its African Centers for Disease Prevention and Control, and I applaud the African Union's stewardship and strong coordination role. The launch of today's partnership between the European Center of Disease Prevention and Control and the Africa CDC is a crucial step to further strengthen our common efforts. I'm indeed very pleased that EU funding enables a long-term collaboration between these two agencies specialized in health security to the benefit of both the people of the African Union and the EU member states. Working together, you can make strides in key matters of preparedness, from harmonized. Your joint work can immensely help countries to strengthen their capacities to prevent pandemics. With this thought, CDC for Africa CDC initiative than ever.
Interesting to hear the importance of the political that has gone into the years and as part of a long-term engagement. Just to cement that, I'd like to pass the floor briefly to the European Commission, to the Directorate General for Development, Mr. Koenderens, briefly just to give us an additional few comments on this.
Well, thank you very much. And indeed, I will try to be brief because we've been listening already to very substantial contributions. I'm not sure it's good for our health if I add to that. But I nevertheless want to say how glad I am of what is happening today. The launch of this partnership between the ECDC and the Dr. Fadi said covers basically it all. And I would just want to maybe add three key messages. The first one is about the importance of human development. And I think that since COVID-19 spread globally in line of defense, and they have facilitated the emergence. And in many cases, they've done that.
Partnership will cover pandemics, epidemics, crises will continue to challenge us. The fact is that both of our agencies have been born out of crisis. SARS in 2003 for ECDC, the Ebola in 2014-15 for the Africa CDC. Now, both of our agencies have already accumulated really a valuable knowledge, expertise, and lessons learned and on how to act and prepare for cross-border health threats during and after the crisis. So sharing our experience and learning from each other is really a valuable asset in advancing preparedness for public health emergency in both continents. So I am looking forward to building this long-term and sustainable partnership between our two agencies with the ambition to enhance health security both in Africa and in the EU. I think I can speak for both of us, John, that both agencies are committed to make this project happen for the benefit of the people in Africa and in the EU. So let's get to work. Thank you.
Thank you very much, Andrea, and reminding us again that both agencies were created as a response to a crisis. So it's no surprise that they see an opportunity to strengthen and deepen their work as we are in the middle of yet another crisis, because that's one thing we can guarantee. The future will bring us more health crises, particularly coming from communicable diseases, possibly zoonosis. So it makes sense not to wait for a quiet time, but to keep going straight forward. Let me now pass to two colleagues from both the ECDC and the ACDC who will briefly give us some of the details of this partnership that was outlined by the two directors. And I'd like to share Marit Koki and Benjamin Judalbay from both the ACDC and the ECDC will do a joint presentation to share with us what's in this partnership. So let me pass over to you, colleagues. Marit and Benjamin.
Thank you. Marit will start.
Marit, go ahead.
So thank you, Tamsin, and good afternoon to all participants, ladies and gentlemen. I will share my screen and the presentation. So I indeed, in few slides, we will show you the content of the partnership. And before that, I would like to thank all the colleagues from both agencies for providing the inputs for the content of this proposal, for this initiative. Few in Africa CDC. As you have heard already, the outbreaks have facilitated our establishment, and that happened for ECDC in 2003 operational. And we are really working on communicable diseases and to engage in Europe-wide surveillance of communicable diseases, monitoring of health threats, and preparing risk assessments for the use of risk managers. And today we have some 300 staff from almost all EU member states and a budget around 60 million euros. And we work with all EU member states and also beyond. The legal framework is not very vast, but our founding regulation and the decision on cross-border health threats. And you heard